Bismillahirrahmanirrahim. Diseases of the thyroid hormone, especially the hypothyroidism, is discussed in this video. The hypothyroidism is opposite to the hyperthyroidism, and the common cause is autoimmune destruction of the thyroid gland. And one of the most common cause is the Hashimoto thyroiditis. It is an autoimmune disease that target the thyroid, lead to chronic inflammation of the thyroid gland and results in thyroiditis. Then there is progressive deterioration of the thyroid tissue and its function that lead to fibrosis or scarring of the gland, and there will be eventual decrease or absence of the hormone producing tissue. So there will be absence or diminished thyroid hormone secretion. So here, instead of the uh, earlier disease in which Graves disease, in which the thyroid stimulating immunoglobulin tend to stimulate the thyroid, here the autoantibodies, they are resulting in diminished activity of the thyroid. There are several other causes of the hypothyroidism, and they may be linked to goiter formation. This goiter is enlarged thyroid gland due to insufficient hormone production. The gland enlarges as an attempt to compensate. The goiter is an abnormally enlarged thyroid gland, and endemic goiter is a type of goiter that is common in regions with low dietary iodine. So historically, this condition is common in areas with iodine deficient soil, including Swiss Alps, Andes Mountains, and Great Lakes region of USA. There is insufficiently provided dietary iodide that leads to inadequate synthesis of thyroxine and triiodothyronine, and there will be decreased iodine presence that will decrease the T4 and T3 hormone. So as there is no thyroid hormone, there will be no negative feedback on anterior pituitary. So there will be increased TSH secretion. TSH stimulates the excessive thyroglobulin production and follicular growth and colloid accumulation. So the thyroid gland enlarges about 10 to 20 times of its normal size. So use of iodide salt to ensure sufficient iodide or iodine intake in diet is a preventive measure for this condition. Idiopathic non-toxic colloid goiter. It is a condition in which there is thyroid gland enlargement that is not caused by iodine deficiency. Usually it is not toxic, may have normal or slightly reduced thyroid hormone levels. The possible cause is mild thyroiditis, mild focal thyroiditis, that suggests a common cause that leads to slight hypothyroidism, and there will be increased THS secretion, and then there is progressive nodular growth of non-affected thyroid area. So there are some enzymatic abnormality in hormone synthesis. These defect impair hormone formation and trigger TSH driven thyroid growth. There is decreased iodide trapping as iodine not efficiently absorbed by the thyroid cell. The peroxidase activity is decreased. The iodide not oxidized to active iodine. Then there will be decreased tyrosine coupling, or the iodinated tyrosines fails to form T4 and T3. The deiodinase activity is decreased. That means the iodine not recycled. So there will be a functional deficiency of iodine. Then there are some goitrogenic foods, certain compounds that mimic the antithyroid drug, for example, propylthiouracil, are found in certain turnips and cabbage varieties. These block the hormone formation that lead to increased TSH and enlargement of the gland. So gland is often nodular due to simultaneous growth and destruction of the different tissue regions. The clinical symptoms of hypothyroidism are extreme somnolence. The sleep time increases from 12 to 14 hours per day. There is mental and neuromuscular sluggishness with slow reflexes and general lethargy. The heart rate is also slowed. There is bradycardia and cardiac output is decreased, and with the decreased blood volume, and the metabolic effect is weight gain despite decreased appetite. There is constipation and cold intolerance. So the skin appears dry and scaly with coarse hair, and the hair growth is also slow. The voice is frog-like and husky due to thickening of the vocal cord. The myxedema also develops, and this is widespread non-pitting edema with puffy face, thickened features, swelling especially around eye and lips. Same symptom occur whether hypothyroidism is caused by autoimmune thyroiditis, endemic, or destruction of the thyroid tissue by surgery or radiation. So, myxedema is a condition that is produced in advanced hypothyroidism conditions. It is a severe form of hypothyroidism that occur in patients with near total absence of thyroid hormone function. The key features of this condition are swelling of the face, bagginess under the eye, thick coarse skin appearance. Underlying pathophysiology is increased accumulation of hyaluronic acid and chondroitin sulfate. These bind with protein to form a gel-like matrix. Excess tissue gel builds up in the interstitial space, and the resulting edema is a non-pitting edema. So means that this edema does not indent when pressure is applied. The consistency is gel-like, so fluid is immobile. So exact cause of these glycosaminoglycan accumulation is not fully explained, but it is associated with lack of thyroid hormone regulation on extracellular matrix metabolism. Atherosclerosis develops in hypothyroidism. The thyroid hormone deficiency alters the metabolism of fat. There will be decreased liver excretion of cholesterol and increased blood cholesterol and lipid level. So the fat breakdown is impaired and cholesterol elimination via bile is impaired. That lead to hypercholesterolemia, that is high blood cholesterol, and hyperlipidemia will accelerate the process of atherosclerosis, that is the presence of fatty plaque or deposits in arteries, and these lead to arterial narrowing and reduced blood flow. So the clinical implication of this condition is peripheral vascular disease, and there is reduced blood supply to the limbs. There is deafness due to vascular damage to the inner ear, and the coronary artery disease can cause early death in severe hypothyroidism, especially mixed edema. So remember that hypothyroidism will lead to hyperlipidemia, atherosclerosis, and then finally vascular disease and risk of early cardiac or coronary artery disease. The test for hypothyroidism are free thyroxine level in the plasma. The radioimmunoassay of free T4 or active form is done, and it is low in hypothyroidism. The BMR is also decreased. So test is measurement of oxygen consumption or metabolism. So in mixed edema, the BMR is about to minus 30 to minus 50 of the normal, and THR or thyrotropin releasing hormone stimulation test is another test that in this test the TRH is administered, and then the TSH levels are measured. So high TSH response is it occurs in normal hypothyroidism. In central rare hypothyroidism, the low or absent TSH response. So there is decrease free T4 thyroxine, decrease low basal metabolic rate that goes minus 30 to minus 50, especially in mixed edema. TSH after TRH injection is increased if pituitary is intact. As we know, the half-life of the thyroid hormone is about 15 days, and the effects usually last for more than 1 month. So thyroid hormone or oral thyroxine intake is the treatment for the condition. Extreme hypothyroidism during fetal life, infancy, or childhood, characterized especially by failure of body growth and mental retardation, is a condition termed as cretinism. It is characterized by impaired body growth, severe mental retardation. The types are congenital cretinism. There is no thyroid gland formed since birth, or there may be genetic defect of the gland. There is presence of the thyroid but unable to produce the hormone. Then there is another condition, that is endemic cretinism, that is caused by dietary uh, iodine deficiency. So the child may appear normal at birth due to maternal thyroid hormone. After a few weeks, movement becomes sluggish and growth, both the physical and mental, slows down dramatically. So the child will have macroglycia. He is obese, stocky, and short in appearance. The treatment and prognosis for this is treatment with iodine or thyroxine that begins within weeks. The timing is crucial. It should start initially, and the physical growth can be restored with proper treatment, while if the mental growth impaired, it will be impaired permanently if the treatment is delayed. So physically there will be severely stunted bone growth. Soft tissues are relatively excessive, so it causes an obese appearance, and tongue is enlarged with difficulty in swallowing and breathing. So there is puffy face with guttural breathing, Imagine try to breathe through a narrow straw while something soft like a sponge is partially blocking the opening. The sound becomes rough, wet, and difficult. That's close to what guttural breathing sounds like. Thank you for watching this video. If you have any query, please write in the comment box.